Hi, my name is Jessica Gavin. Today is July 17th, 2020. I have my notes forward and back. So today I'm just talking about the nervous system. I found that this is a very interesting system for me to learn. I learned a lot of things. I work in respiratory therapy, so I never get a chance to really learn about the nervous system other than its role in respiration and the cardiac function and those types of things. So it's really interesting to me to learn about that. I work with a lot of doctors who are neurosurgeons, and I also work with a lot of doctors who are neurologists. And the difference is the neurosurgeon is dealing with the surgical treatment of like a disease. So if you have a trauma come in or a brain bleed and those types of things, and you have to do surgery on it, that's your neurosurgeon. The neurologist focuses on basically everything else. They deal with things like epilepsy, headaches, they do strokes, any kind of neurological condition that they help with diagnosing, treating, and studying. That's going to be your neurologist. The organ that was most interesting to me was the cerebellum, and the cerebellum is located inferior to the occipital and temporal lobes, and then it's posterior to the pons and the medulla oblongata, and it's just distal to the spinal cord, just barely outside of that. The main portions of the cerebellum are the anterior lobe, the posterior lobe, the flocculus, which is like a crescent moon, it's on the anterior lobe, and the vermis, and that's the thing that connects the two hemispheres right outside of the arbor vitae. And all of those portions that I just mentioned, the anterior lobe, the posterior lobe, the flocculus, and the vermis, they're all right and left halves because the cerebellum is separated into two hemispheres. On the inside of the cerebellum, you're going to find your arbor vitae, and that's looks like a little bit of a tree. It's the white matter part of the cerebellum. The main functions that I saw that the cerebellum does is deals a lot with muscle tone. You have coordination of your goal-directed and spontaneous movements. You also do a lot of your posture and balance. That deals with the cerebellum. Your eye movements. So if I'm looking around, that's mostly my cerebellum. And then you have aspects of motor learning that deal with the cerebellum as well. And the cerebellum also deals with some cognitive functions, things like learning to ride a bike, learning a new language, those types of things. So it's a pretty versatile organ, and it's really interesting to me.